All right, Joespeak podcast. Long time no hear for some of us, even though we've got about 15 episodes that hopefully people have been digging into. I would like to think that they are revelation every time you listen to them. So make sure you check them out. What we really want to get into actually now, and being very intentional about it, is public health and its connection to equity. My day-to-day, we deal with equity issues. We look at the Goliaths in our society, and we all know that public health is one of those Goliaths. Some people will call it wellness, or there'll be aspects. There'll be, wellness. There'll be whole person care. There'll be all these different things. And I've got someone that's going to help us talk about that, who has quite a journey in public health, is absolutely an expert in her field. As a matter of fact, she's got her own Wikipedia. I'm calling myself looking her up, figuring her website will pop up. Wikipedia, boom! I'm like, okay. So in any event, I'm having fun. But I've got Dora Barilla with us today, who is the head of HC2 Strategies, and most recently, and the reason why we've connected, is our newly designated public health advocate for McCune Wright Arevalo, the law firm. We're going to connect the legal to the medical before long here. But Dora, it's good to see you. How are you?
Thank you, Joe. It's great to be here, and I'm doing well, thank you. I think the moment where we're at now is to build the causes of life.
Right.
We know it causes death.
Right. Okay.
We know it causes death.
Interesting. Yeah, that's a good point.
And, we've been in a reactive mode.
Right.
And we've been providing urgent services to prevent death.
Right.
And so I think the paradigm shift is how do then we create investments in communities and think about, how we're building community through addressing what we call the vital conditions.
Right. Excellent. So talk about, you got to build the house a little bit. Talk about your expertise and how you came to the public health space.
The journey of public health. Well, mine probably isn't the traditional journey or path. I started really with an interest in prevention and wellness. What makes people healthy? Right. And 35 plus years ago, I don't want to age myself here, when I went into undergraduate.
Started when you were 3.
Yeah, I was 3. And,
right.
You really look at what are some of the traditional medical fields, nursing, being a physician. And so I went in and I received a bachelor's of science in sports medicine, because I figured that could give me all sorts of different avenues.
Sure.
And so my first job, I landed in managed care. So that was in the early 90s, looking at, it was really physicians looking at how they were managing care. And I was the director of health education and preventive care, is what we called it now. A lot of times they call it population health today. And my job was to look at why are people heavily utilizing the healthcare system? So why are they coming into the emergency department, 5 times in 6 months?
Right.
What's really happening in their life? And that really started my journey, that it wasn't just the clinical. When you came into the emergency department, whether it was with chest pain or abdominal pain or, you had a stress headache, well, we often just treated with a prescription those things that manifested. Right. But what I became keenly interested in is what were some of the social conditions or life experiences, or what was happening at in the home or on the job or in their housing, in their, whether it was in their apartment building or in their community, that was really making people sick. And really understanding what we call the root causes of health. Right. And that just really intrigued me to look much broader than just the traditional hospital and healthcare system, but to really look at the broader community and how we design communities and how we treat each other, some of the social connections. And it's brought me on a wild chase and a phenomenal path. I'm also an entrepreneur. Right. And really didn't see myself in the traditional public health setting. Sure. Always partnering with public health. Right. But really looking at what's the intersection, what's the connection, and what can we do differently in society that's really going to promote health. Right. I think I've worked with a lot of cities in, looking at overall health and well-being in cities, and probably done more to prevent, illness in communities rather than anything I've ever ever done in healthcare.
Right. Wow. So tell me about, let's deal with some of the realities. I'd be interested because of your perspective. As we established, you started when you were 3.
That's
You've
right.
been in it for 35 years. How has, at the risk of asking a broad question, how has public health changed? And what are the things that we perceive properly, or that we perceive or that we perceive improperly in terms of how we view, how we evaluate public health and its connection to other issues?
Yeah, thank you, Joe. I mean, the 35 years that I've been really looking at public health has changed so dramatically.
Yeah.
You know, first of all, people actually know what it is.
Right.
And even in the last 5 years,
It's
really changed significantly.
Right.
I was a healthcare executive, and I had an MPH, what we called the Masters in Public Health, when I started. And most people were MBAs.
Right.
Didn't even know what, a lot of what public health did or what it was. Because a lot of times if we did our job well, no one knew, because we prevented things.
Right. Wow.
And so people didn't understand the value of public health.
Right.
And they thought of it as just, clinics or, in underserved communities. But it's really a holistic perspective in terms of not just providing vaccines or fresh, good water, or looking at, make sure that you have healthy foods, clean air.
Right.
It really is the big picture of what is it that creates health in our bodies.
Right.
And, you've seen with COVID-19, I think public health has just really shown their face in terms of what they are and who they are. And unfortunately, though, a lot of times, they're not your traditional communicators.
Right.
And so the message wasn't always well received from public health directors.
Sure.
Because people felt like it was, infringing on their rights, or, lots of different perspectives of what public health is. But, one of the things that I really valued about public health, just working in healthcare, is that they were really advocating for communities and individuals.
Right.
They
Sure.
didn't have a pocket to fill.
Right. Sure.
The value of public health is to create health.
Right.
And there's not always a lot of wealth in that.
Right. Right. Sure.
And so, you've really seen people beginning to understand that public health is an important part of an infrastructure in any community to make us all well. And also to look at, often even in communities, you see unequal distribution of health.
Right.
And some people are healthier than others.
Right.
And why is that? And really understanding, the difference between, inequality and equity.
Right.
And how do we look at communities to make sure that people have, a healthy conditions in a community that actually produce health.
Right. Right. So tell me, I want to follow up a little bit. You brushed on it a little bit. COVID-19 in terms of, I would imagine, from public health, there's a general understanding that there are certain goals, certain things that you're trying to accomplish. You're looking at issues like equity. I think that's really powerful and really interesting and useful and necessary. Tell us how the pandemic turned things on its head, and how it confirmed things that maybe a lot of us thought, or at least those that are in the field thought about the public health space, or did it make anything be rethought? Well, maybe we need to look at X or Y or Z differently. How did that affect things?
Yeah, but it pretty much changed, the world changed significantly for public health. And the fact, it did several things. Right. It really magnified the inequities in our communities.
Sure.
I mean, just that was laid bare.
Right.
We've noted in public health that it had existed.
Right.
But you couldn't, it was it blotted out the sun.
Right, for sure.
Literally.
Right.
And you saw who was really compromised in a community. Right. In terms of just even having access to basic needs like food, because people were in isolation.
Right.
So that was, I think one of the biggest things was just a highlighting. But it also, I think it revealed the underinvestment in public health.
Sure.
And, like I said, we absolutely need healthcare. It's so important.
Right.
But if you look at our model for reimbursement, it really, hasn't been for public health.
Right. Wow.
When our communities needed us the most.
Right.
A lot of them were struggling financially.
Sure.
And so I think really thinking about what is the community and what's the portfolio of investments in our country that we want to make in terms of public health. Right. And understanding that, people, politicize it. Public health is not political.
Right, yeah, for sure. Yeah, my gosh.
Yeah, I mean, it really is about how do we keep people well and how do we keep them safe?
Right.
And using science to make decisions. Right. And, it's not one political party or the other. It really needs to be us coming together as community.
Right. So while a pandemic or any dramatic event often amplifies what the problems are, I think it also amplifies what the potential solutions are because, among other things, maybe you have more listening ears. Yeah. So it's interesting because it sounds like, and I want you to talk about HC2 strategies, because it seems like to me, you mentioned before that you weren't quite comfortable with the function of public health that you were in, and that led to you pursuing this entrepreneurial side and doing HC2 strategies. Tell us about how what you do and what you are already doing really fit into the framework of helping to provide answers.
So HC2 Strategies stands for Healthy Connected Communities.
Okay.
And if you look at what creates health, and if you look at a public health model, what I found where there was a lot of, whether you're a hospital, a clinic, healthcare, public health, the faith community, or just looking at the, businesses in a community, they weren't really working together. Right. So one of the things that I've found, and where my entrepreneur has come in is really looking at being a bridge. Right. And to say that, we can practice public health in businesses. We can practice public health in faith communities.
Right, sure.
And how do we bridge the gap and have the conversations in a community that, I think if we get down to the bare minimum, we all want to live in a community that has, low crime, fresh water, clean air, high employment. We want people working. We want people educated. Right. And so how can we break down the barriers and have the conversations that are really necessary for us to create access for people to have, to be able to achieve health and wealth in a community. And so, I think the one thing, I'm a bridge, looking at different sectors to say public health is about a lot of things. Right. And how do we connect the dots?
Right. So talk about equity in the well-being framework, how we address the drivers of health. Talk a little bit about the drivers of health. Give folks a 101 about the drivers of health and well-being and equity, because in your paperwork, I see that you put all that together, or that it's a standard that there's a dot to be connected. There are dots to be connected with all of these. So talk about how we address those drivers in terms of getting from point A to point B, and here's what we need to be doing in public health. This is what it looks like. Here's where we are right now.
Right. So I'm the optimist, so I like to look at it. We're in a good place to really rethink about mental models. Right. And how are we thinking about investing in our communities? Let's start with equity. Right. And, I've often say that, we have health in our communities. It's just not equally distributed. Mm-hmm. And that doesn't mean that we treat everybody the same and give everyone the same thing. Right. That, when we're looking at equity, it means that somebody might need something more. Right. Sure. If you're, if you've got a broken leg and you don't have a car and you don't have access, your needs are going to be a little bit different. Sure. Than someone that has means and can hire someone and has a car and can access groceries or whatever that is. Right. So really understanding what equity is. Right. And how do we address that? Right. And, have a civil conversation and invite people in to look at what equity is. Right. And then you think about, it really is. Ask any 5-year-old, what do you need to be healthy? Right. You need human connection. You need food. You need water.
Right.
You know, if you get sick, you need access to health care. Right. You need a job. You need a home. Right. You need a way to, you need agency in life.
Right.
And so what are often what we say, what are the leading causes of life?
Right.
And I think the moment where we're at now is to build the causes of life.
Right.
We know it causes death.
Right. Okay.
We know it causes death.
Interesting. Yeah, that's a good point.
And, we've been in a reactive mode.
Right.
And we've been providing urgent services to prevent death.
Right.
And so I think the paradigm shift is how do then we create investments in communities and think about, how we're building community through addressing what we call the vital conditions.
Right.
Versus just the urgent services.
Right.
That's a shift.
Right, sure.
If we think about all the different sectors that are coming together, and, what can we call them, stewards of health?
Right.
So whether you're a physician, you're a teacher, you're a pastor, a rabbi, that, you're a steward of health.
Right.
And how do we work together to be better stewards of health?
Right. Wow, so it's interesting. I think one of the things that I'm taking from what you're saying is to be reminded or informed, as the case may be, if we didn't know already, is that we actually all have a stake and a part in each other's health.
Right.
Right. And so there are certain things that we can do. And so you can't disconnect an equity discussion. It is an equity discussion if person X who breaks his leg doesn't have services to get food, a ride to the doctor, the things that he may need, versus person Y who has all the resources in the world, including somebody coming in to take care of them. So you don't get to disconnect them. That's a really interesting concept. Have you seen that people seem to be more willing to have that discussion and be open to the idea that, I don't know if you call it whole person health, or that whole person health is really a thing. This is not just, just some kind of catchphrase, but it's actually something with real possibilities. And if we don't deal with it the right way, something with real consequences.
Yeah, we're absolutely gaining momentum on that. Right. And I've been, when I was 3 and I started, right. And I'd have these conversations. Often there was a disconnect.
Right.
And because people are stuck in mental models of we're a hospital or we're this, and this is what we treat.
Right.
And looking at the complexity of what makes us whole.
Right, sure.
Takes a different mindset.
Right.
And so I think that's where we're at now, is really looking at, whole person care in terms of what does, create health. Right. And, so often so many sectors are funded to do their thing.
Right, sure.
And it's the connection and the integration and alignment of that. Right. And so I have never experienced, just what I'm experiencing now is that everybody is interested in this.
Right.
Everybody wants to address this.
Amazing. Yeah.
I mean, with COVID and some of the civil unrest that's happened over the last couple of years, right. I mean, it's been elevated to a point that I've never seen.
Right.
But I think now it's what are the meaningful strategies?
Right.
How are we not just putting a Band-Aid on, addressing these issues, right. Looking at some of the root causes and really thinking about, whether it's legal issues,
right.
Whether it's medical issues, sure. Whether it's, economic disadvantage, and how do we address those, collectively? We're seeing that momentum gaining every day because right. People realize it was broken.
Right.
We were fragmented. We were siloed.
Right.
And we really need to now rebuild together.
Right. Right. So this is interesting. So this is how we come across each other through, being recognized in your field for what you do. Our firm, McCune Wright Arevalo, has this, managing partner who grew up with a view through the window of healthcare, the healthcare sector, the health sector. Loma Linda is a place in general that has been a steward of good health. You know, you're at the gas station and there's a 90-year-old, you know, who's driving his car and getting past you. They do a very good job at health and health things. Loma Linda Medical Center, where you worked, and where I believe you're a public health officer.
I got my doctorate of public health there.
Gotcha.
And have an appointment in the School of Public Health.
Right. And so, you know, they have always been considered on the cutting edge of health issues. So now we talk about this intersection between taking the model in health and actually applying it to legal. So the whole idea, this premise, which is nuts, people haven't really thought of this, is that how whole person health actually has a legal connection. So tell me about how this conversation happened that, you know, ends up basically having us intersect.
What an exciting time. And
Right.
like I said, just that I don't know if we would have seen this 15 years ago,
Right.
that people would have made that connection.
Right.
And it is the time.
Right.
Because if you look at, even when I was working in health systems, we would
Right.
have what we call medical legal partnerships.
Right. Well, yes.
Because
that's right. Yeah.
we would identify that there were legal issues that were impacting, whether it's conservatory of somebody
Sure.
needing care, whether it's looking at some of the conditions in housing,
Right.
especially for children in low income families.
Right.
A lot of times there are a lot of legal issues that were impacting people's health.
Sure.
And so I think it's just a natural evolution now.
Right. Sure.
To say, well, let's just make that real, and
Right,
let's make
sure.
that a part of how we're thinking. If we'll call it whole person care. That people need a legal home.
Right. Yeah.
Do people know what their rights are?
Right.
I'm working with a health system in Michigan right now.
Right.
And I was just talking to one of the physicians that's still working in the Flint water issue.
Right. Wow. Sure.
And
Sure.
all these years later,
Right.
it's still an issue. It still hasn't been, entirely resolved.
Right.
So, you really need to look at overall, what are the things in communities,
Right.
and how do we have advocates
Right.
for individuals that aren't experiencing the vital conditions that create health?
Sure.
They didn't have so many of those, mothers that were bringing, their children were getting sick with that water.
Right.
Didn't have a voice.
Right.
They barely had a place to provide care for their children, let alone a legal home.
Right.
So if you think of if people had access to both,
Right.
how that really could shift and change things. If
Right.
we made legal services more affordable
Right.
and more accessible,
Right.
then people would know what their rights were,
Right.
and people wouldn't be apt to be taking advantage of, especially, individuals that don't always have the resources to
Sure.
speak out. So
Sure.
if we want to talk about equity,
Right.
wow, providing legal services to people,
Right.
throughout the community,
Right.
that's a game changer.
Right. I could never, in my mind, disconnect health and equity anyway. Right.
Right.
Because health issues are equity issues. But then for what we do, for instance, in our department, racial and economic justice, I'm always looking for equity issues. I'm looking for what are the Goliaths that are making it harder for people in certain economic categories, et cetera, to do. Sorry about that. So what are the things that make it harder for regular folks to get along? What are the things that are concerns for people in certain communities and people in certain parts of communities that are not concerns at all for other communities? Because once you answer those questions, now you're having an equity discussion. So it was a natural, when I heard about what was being contemplated and you coming on board, it was a natural evolution and a natural discussion, the whole idea that just like you can't disconnect legal and equitable. I talk a lot about what's legally right versus what's morally right, and what hopefully we do is do what's morally right, and what's legally right catches up to it, right? you cannot disconnect any easier, or you can also see the connection between health and equity. So it's like now we're talking about health, equity, legal, all together.
Absolutely. And if you look at, I love your analogy of, the moral issues catch up with the legal issues,
right.
because so often, I think we've almost become immune
sure.
to some of the moral issues that are happening
right.
in our communities, and no one is stopping to think twice about them.
Right.
Not to go back to the water, but that just blows my mind that in
sure.
2018,
sure.
that was an issue.
Right.
But it goes to show that was okay.
Right. Yeah.
And what would ever make anyone think that was okay?
Right.
And so, just elevating these issues and having these conversations about equity and understanding, what does create equity.
Right.
Obviously, having clean water in a community is a basic need.
Right.
Especially in the United States, that's not, just a given.
Right.
But then you think about education equity.
Right.
Economic equity.
That's right.
How do we, look at the whole picture and create those conditions where people can achieve equitable opportunities in a community.
Right.
And, and I think I'm a big fan of creating the conditions in which people can thrive.
Right. That Flint water issue is a perfect example of something that has legal ramifications and it has equitable ramifications. Everybody ought to have clean water, just like everybody ought to have the things that make for good public health, just like everyone ought to have the things that will simplify their lives ahead of certain events, death, disability, the need to make decisions, legal-related decisions, and things like that. So I'm really excited about the way that we're thinking. We're trying to look around the corner and see what's coming next, and understanding that the legal piece has just as much of an equitable implication as the medical.
Absolutely.
And the health piece. And so it's really interesting kind of where we're going and your role in it and being part of it. I know, and I'll probably have Kimberly Lewis come through at some point as well, talking about Pro Se Legal and how this organization is really going to be a ground floor for identifying services people can have on a low-cost basis, send them in another direction as necessary, or whatever else, as part of this larger effort to benefit the community and help move it along. You must feel incredible about the idea that the thing that you've been doing your whole life is something people are paying attention to now.
It really is gratifying because I'm not alone. And,
right.
It's hard to do things alone.
Right.
And I think you're right. We've just really caught up with now is the time.
Right.
And the next generation, they'll have no tolerance.
Right.
They see it.
Sure.
And, they want to make the changes. So it really is quite gratifying.
Right.
And, to have this interconnection of medical and legal.
Right.
It's just amazing. It is groundbreaking. It is really about how are we going to really start changing communities.
Right.
I've spent my life, most people will call me with questions about medical services.
Right.
Dora, where can I get a doctor or see this
sure.
or see that? And, just going back to COVID when people were calling, healthcare professionals because we didn't know.
Right.
Writing wills in a bathroom.
Right, sure. Oh, yeah.
Or just the deaths that happened and, people not, retaining access, their resources.
Sure.
And, even if it is a $200,000 asset, in a community, how do you protect that in a family and make sure and, really look at equity from a legal perspective in terms of, building wealth.
Right.
That's a game changer.
Right.
And I'm really excited about it. And so the fact that the world is catching up and that McCune Wright Arevalo is, engaging in this and offering Pro Se Legal to communities is very satisfying.
Right. And it's neat to be able to be honest about the fact that the law and the rules and all of these other things are vehicles or are housed to create the what, which is moving towards equity issues and those types of things. They're tools and things to be used. And it's nice to be able to be honest about that. So this has been great. Let me ask you this to close. Give us your 5 to 10 year wish list on our what we're seeing, what we ought to see from a societal standpoint as it pertains to public health, and what that has us doing and what kind of outcomes hopefully we're moving toward and have gone a great deal towards accomplishing in that time.
Yeah, so I think we're far beyond understanding and defining public health.
Right.
Resourcing it.
Right. Okay,
and making sure that we're resourcing public health in a holistic really view.
Right.
And that we don't continue with the silos.
Right.
That we're sitting here in actually the Riverside City Library.
Right. Yeah.
And you look at the design of this it's not only about just reading a book.
Right.
I mean, there's so many different things that are happening within this organization. And I see as we build communities that, hospitals, clinics,
right.
physician offices, not only are referring for, radiology or lab,
right.
but they really understand what makes people whole and what makes people healthy.
Right.
And that they can make a referral if someone has a legal issue.
Right.
Or even within, our legal services or social services, that we're building communities.
Right.
We're not building silos. We're connecting people so that they have access to the services that create health. And it's the norm. It's not an anomaly. Right. It's how we build community.
Right. Fantastic. So this is very consistent with what we've talked about in terms of one of the things we're trying to do. Sure, we're practicing attorneys and that type of thing, but we also, and it's not a but, and we are seeking to have community contact that allows us to help assess needs and to address them. And by the way, those needs aren't always best addressed by litigation or by suing someone or by being in a knock them out, drag them out 10 to 15 year fight. Can we be part of, and we want to be part of, changing the discussion so more of us understand what's important and we move toward that together? And now you've got smart people in different sectors, in different spaces, in this web of mutuality, moving us forward as a society, and then we're better off because of it. So I appreciate you being part of this discussion and part of this discussion you've been a part of for 35 years, but part of this discussion today that just gives us a window as to what's coming. So that makes me pretty excited because I see some great things coming around the corner, some things that haven't been done before, but which make a great deal of sense. So
I agree, and thank you, Joe. Let's make it happen.
For sure. All right. Hey, Dora Barilla, I told you we had a good one. Once again, Joespeak Podcast, you know where you can check us out. Look up Joespeak Podcast on YouTube, on all the podcast platforms. You can follow us at Joespeak_MWA. McCune Wright Arevalo, and we'll go from there. So until next time, take your time leaving, but you hurry back. You guys take care. Thank you.